Welcome to the first of our In Conversation, where today I'll be talking with Dr. Greg Parker about what advanced care planning is and how to support a conversation with your health professionals about your advanced care plan. I'm Lesley Habel, and I'm the National Manager for Advanced Care Planning Australia. In the spirit of reconciliation, Advanced Care Planning Australia acknowledges the traditional custodians of country throughout Australia and their connection to land, sea and community. We pay our respects to their elders, past and present, and extend that respect to all Aboriginal and Torres Strait Islander peoples today. We also pay our respect to anyone going through sorry business. And today's guest with us is our co-director, Dr. Greg Parker, who is also the Director of Brisbane South Palliative Care Collaborative. Greg's going to be talking to you about how you can talk with your GP or health professional about your advanced care plan. So Greg, in your words, what is an advanced care plan?
Certainly. An advanced care planning is really about looking at planning for future healthcare needs. In essence, it involves contemplating what's important to us, considering who we would entrust with making decisions on our behalf and talking on our behalf if we weren't able to voice what is important and matters, especially when it comes to treatments that would be important for us or we'd want, and our thresholds in treatments we wouldn't want. But also, it's more than that. It's about our values, who am I as a person? What was important to me? Painting the picture of who we are, our beliefs, our preferences, our wishes.
Just reflecting on that, Greg, I suppose it depends on the scenario too, doesn't it? Whether you're
Correct.
End of life.
Correct.
Whether you've been in a critical incident, such as a car accident.
Yeah.
It's not all about dying, is it?
No, it's not. And look, there are many hypothetical situations that can be talked about. But I think if you bring it back to the essence of who am I as the individual and how do I want that to get across to the health professional, to the team looking after me, so that they can be best informed to make decisions about my treatment, appropriate treatments, and how they can wrap care around me and support my family in delivering that care.
As a palliative care doctor, you must have supported thousands of people at very vulnerable times in their life. How have you found, for you as a health professional, you've been able to provide more person-centred care by referring to someone's advanced care plan?
And I think that's a really important question, and I think bringing it back to person-centred care. We know that advanced care planning is the cornerstone for person-centred care. Being able to have a knowledge and know who the person is and their thresholds for what they would want in their treatments and not, and where that would be, is really important in terms of being able to develop that care plan at that critical time and being able to support family. I think it's sad when I'm sitting down at consultations or sitting with families, especially when someone's in those last phases of life where they're unable to make decisions, actively dying, and the question comes across, especially when we get involved late. They say, Greg, I wish we had those conversations early, that I could have had that conversation with mum or dad or my sister or my son early on in the piece to know what was important for them. And in fact, I didn't realize this is what mattered to them, or I didn't know this about them. And I assumed things.
If they had have had that conversation early. So Greg, I was just reflecting on my advanced care plan and what matters most to me. So, what do I need to share with others? And I was thinking about, feeling quite powerless at times when I've been in hospital, and having that voice through an advanced care plan would be so powerful for me to share what matters most through what I would like my health professionals to know about me, such as I want my loved ones to remain in the room with me when a nurse comes in to do personal care. That really is an intimate thing for me, and they know me.
You're right. You're so right, Lesley. And look, it's more than just the treatments, the medical side of things. I think there's so much more to advanced care planning. You know, if I was in a space where I was seriously ill, and I've got my pet, my dog, can they come in and spend time with me? And that just creates that additional feeling of safety and comfort. Or if I'm in a conversation with someone, actually I would prefer if my daughter, my son, or someone I trust is part of that conversation. And in fact, even where you find situations occurring where it's as simple as I want to be in my garden, and this is really hard, but very much again I reflect on end of life care. Being at home versus being cooped up in a hospital bed, or going for a drive, just enjoying a meal somewhere, or going on a holiday. That's important to me. Or actually just going fishing, those are the things that helps shape and form the care sort of a package that is delivered and the support that's required. Because if as a health professional we know what's important to the person, we can then sit down together with them, their family, their the entrusted person that's going to be being that voice for them, and those that can provide their care, and say, how do we shape this so we can ensure people's wishes and preferences are met.
I'd like to thank our viewers today for sharing in this conversation with Greg and I. What we've heard today, Greg, is that sharing what matters most with your loved ones, your substitute decision makers, and your health professionals really can assist at times when you really need good care from your health professionals.
Absolutely. And again, thank you to our viewers for being part of this and for you inviting me. Just to emphasize again, advanced care planning is a process that's continuous, and it will change over time, and that's okay. But the important thing is for the conversation to continue.
Wonderful. Thank you, Greg. I'd like to thank our viewers today for joining Greg and myself in conversation. I'd also like to encourage you to link in with our Facebook page or link into Advanced Care Planning Australia through our website at www.advancedcareplanning.org.au. Thanks so much for joining us, and we'll see you in conversation again. Bye for now.
Bye.